What's up? Hey, Brendan. Hey, Annalise. How's it going? All right, we're gonna get Dr. Henn in, and then we'll introduce ourselves. Started. Hi, Dr. Henn. How are you?
Hey Dave, how are you doing?
I'm good. Doing good. I'll introduce myself. I am David Wilson. I am a Whitman-Walker influencer. Today, and my pronouns are he, him, his. Today, we're with Dr. Han today, who's going to give us a little information about the pause on the Johnson & Johnson vaccine. And so, Dr. Han, would you like to introduce yourself?
Sure. So I'm Sarah Henn. My pronouns are she, her, hers. I've been a Whitman-Walker for 14 years, and I'm an infectious disease physician. Excited to talk about vaccination today.
Yeah, so we're bringing Dr. Ham back tonight so she can answer any questions about COVID-19, including the vaccine manufacturers, vaccination rates, CDC guidelines, and more. Again, Dr. Han is the Chief Medical Officer at Whitman-Walker Health. She's been there since 2007, as she said, and is a board-certified physician in infectious disease and internal medicine. Doctor, you also hold a master's in public health, right?
Correct. Yes, I do.
Nice. Dr. Henn is here to answer any questions that you all may have in real time. And so, please feel free to drop any questions in the comments, and we'll address them as we go along. I do want to start our Q&A by first asking about the pause last week. So last week, the federal health authorities recommend that providers temporarily stop administering the J&J COVID-19 vaccine while they investigate a potential link to red blood clots that had happened in some patients. So does this pause actually mean that the J&J vaccine isn't safe?
No, I mean, I think this is a very rare side effect that, and the FDA and the CDC are being extremely cautious and want to make sure they understand this side effect and that providers and physicians know about the potential of this and make sure that they gather all the information they can about these very few cases and see if there are any other cases out there. I think, what we know is that there have been 7 cases or reported out of, or 6 cases, 7 cases reported out of close to 7 million vaccines. So this is really a 1 in a million side effect right now. But but it's a serious side effect, although extremely rare, and it is something that similarly has been seen in Europe with an AstraZeneca vaccine as well. And so getting a better understanding of what it is, how to treat it, they really felt they needed to make a pause and gather that data.
Right. And so I actually know a few people who have actually got that Johnson & Johnson vaccine. So if you are one of those folk who decided to go with the J&J vaccine over some of the others, you know, should they be concerned? Like, what symptoms should they look out for?
So if you've gotten the J&J vaccine, congratulations for being vaccinated. I wouldn't worry about the fact that you've gotten that vaccine. We don't expect that vaccine to have long-term side effects. We want people who've gotten that vaccine in the last 2 to 3 weeks to be aware if they get any symptoms. So if they get swelling in their legs, severe abdominal pain, if they get sudden acute onset of breath or a severe headache like they've never had before, we want them to take that seriously and get it investigated. But for people who've gotten the vaccine more than 2 weeks ago, I think you should be happy to know and feel secure to know that you have immunity to COVID, and that's a good thing. And so, I also have lots of friends who've gotten that vaccine. I wouldn't, and I think they are still vaccinated, and they're still vaccinated in an extremely safe and effective vaccine. And that's really the
So, if people start experiencing, symptoms that could potentially relate to, the blood clots that we talked about, like should they go to urgent care, emergency, like what procedure do you actually recommend for those folks?
So I would, if you have any of those severe symptoms, I would go to the emergency room to be evaluated. If you have more mild symptoms or something you're unsure about or anxious about, reach out to your provider and talk to them so they can kind of ask you more about your symptoms and make a recommendation about how you should be evaluated.
Got it.
But
Also, I got I got a vaccine. I didn't get the J&J vaccine, but I also know there is a website where you can report symptoms and things like that if you're experiencing any of those. And it's kind of just helping the CDC understand what those potential impacts are. I don't have the website right in front of me, but there is a website that you can Google, and if you've gotten the vaccine, you can report any of the symptoms that you might be experiencing.
yeah, at the time you get the vaccinator should have handed you a card or given you information about a vaccine reporting website. And if you sign up at the time you get a vaccine, you'll actually get text messages pushed out to you to answer questionnaires about how you're feeling and how everything is going. And certainly all providers know about to report to the vaccine adverse events website if they do see patients who've had an adverse event. And that can be anything from a mild allergic reaction to, possibly a severe blood clot we're talking about.
Gotcha. And so for those folks who, got the Moderna or the Pfizer, does the J&J pause actually affect those vaccines at all? Does it affect the general pace of vaccinations or even the end of the pandemic? Like what impact do you think that'll have on the other vaccines and what we're like the trend that we're seeing now?
Yeah. So first off, the Moderna and Pfizer vaccines are a different platform, right? They're both messenger RNA vaccines. And so we don't expect to see this side effect with them. And this isn't something in the hundreds of millions of doses that have been used of those vaccines that we've seen at all. Both the AstraZeneca and J&J vaccine are using an adenovirus platform and is probably related to that platform that's triggering this very rare side effect. Right. The United States overall is in a good position in that we've acquired a lot of more vaccine than we have people. So I think we're going to be able to continue to vaccinate people. But this will slow that process a little bit. I think, I expect that we'll hear later this week from the CDC and the FDA about moving forward again with J&J and how they're going to recommend that we move forward. So we'll wait to hear from them. But, the J&J vaccine, it's important for the vaccination effort for a couple reasons. One really important thing is that it's one shot and you're done. So one and done. For people who have difficulty coming back, people who are homebound, who someone has to go out to them to give them the vaccine, for people who don't have a permanent residence, a one and done is a really great way to get fully vaccinated. And it also doesn't have to be frozen. So in places that are rural, that, don't have the equipment to freeze the vaccines, J&J also it has an important role there. So, I do hope that we get guidance from the CDC and FDA about how to use this vaccine because it's still a very safe vaccine and it does have a role in our vaccination efforts.
Yeah. We actually have a good question. Maybe you could give some advice there. So if folks have an existing history of blood clots, should they avoid that J&J vaccine altogether? Or what would I guess as a medical professional, what would you recommend?
Yeah, I think that wouldn't be unreasonable. This blood clot reaction is really an immune reaction. So it's not a typical blood clot in that what we're seeing is people who are developing this reaction are developing antibodies to platelets. And platelets help us stop bleeding. So they essentially plug the hole when we first start bleeding to help, and then our body forms that clot or scab, right? So what's happening in people with the J&J and AstraZeneca vaccine is they're actually developing antibodies to platelets, and that's causing their platelet count to drop very low. And those platelets are then forming clots. This is an immune reaction we've seen with other drugs as well. So there's a medication, heparin, that physicians will frequently use in the hospital to treat blood clots, and occasionally people can get the same immune reaction to heparin, or very rarely. So this is something, I guess my point is, it has a different etiology, right, than your run-of-the-mill blood clot. So if you've, so it is very unlikely, even if you've had a blood clot in the past, that you would have that kind of immune response, because it is related to that. But certainly, if you've had a blood clot in the past and you have an option to choose a vaccine, I think it absolutely makes sense to choose one of the other vaccines.
Got it. And so earlier you did mention, that there obviously will be a little bit of hesitancy around getting that J&J vaccine, even if we are approved to use it going forward. I guess, how do you think Americans can have confidence in that vaccine again?
I think it's really important to understand how rare of a side effect this is. And I think we're also going to be looking to the FDA and CDC to learn more about the people who developed this side effect, so we can try to kind of narrow our recommendation and make sure that people understand who might be at increased risk for this side effect. But I think we're talking about a side effect that's occurring in less than 1 in a million people. Someone's risk of COVID, no matter what age you are right now, is much higher than 1 in a million. And even your risk of death, if you're a healthy young person, is much greater than 1 in a million for COVID. So I think putting that risk kind of into perspective is really important. And then we'll look to understand more about these cases that occurred to try to help make recommendations for people around vaccination.
Great. So thanks for that information. Also, just want to remind folks, if you have any more questions, feel free to drop them in the comments. The question about the blood clots was a really good question. And if you have any more, feel free to drop them in the comments. So obviously, a lot of people are getting vaccinated. Even the president announced that, everyone is eligible for the vaccine now. So with all this focus on the vaccine, and I think we can often forget about the impact of the disease itself. So would you still say COVID-19 is a problem, or do you think we're getting closer to normal these days?
I wish we were getting closer to normal. Unfortunately, I think people are tired of distancing and the precautions. So I think a lot more people are out and about and gathering. But with that, we're also seeing a rise in cases. So, we certainly are in another peak. In the majority of states across the country and the District of Columbia, we've seen an increase in cases from where we were a month ago. So we still have to kind of double down and be careful and cautious. I think the rise in cases is, in part due to the new variants, which are more easily transmissible, and also in part due to kind of, COVID fatigue, and that we are all tired of not gathering. And it's spring and the weather's nice and we want to get together with friends and see people again. But I think we still have to be careful and be patient. So I think we're close. I think, all across the United States now, everyone who's 16 and older is eligible to get vaccinated. And the faster we get that done, the faster we'll be back to normal. So I really hope that we'll be at a point in the United States where we can have a very normal summer. My dog agrees with that.
Yeah. All right. So we have a couple of questions, good questions here. So I actually think I saw a news article that mentioned that Pfizer recommends revaccinating in maybe a year or so. So this person is asking, if they've received that vaccine early, maybe January, February of this year, what is the likelihood of them having to get revaccinated, I guess, before 2022?
Yeah, I think we are still waiting to see how long immunity lasts, because these vaccines were granted emergency use authorizations very quickly. Even the people in the trial had only had the vaccine for several months when we all were able to start getting vaccinated. So I think we expect that people will probably need boosters. I don't think we yet know how often. Part of that's going to depend on variants, and part of that's just going to depend on how long your immunity lasts after a single dose. And those things are still developing. So I wouldn't be surprised if it becomes something like the flu vaccine, and who knows, maybe it'll be combined with our flu vaccine down the road, and that we'll get it annually, but we're still waiting to learn the answer to that.
Got it. And my friend John says that he's seen people become, more lax on mask wearing. Once fully vaccinated, is there a respectful mask social distancing behavior for fully vaccinated folk?
Right. The CDC has updated their guidelines around masking for people who are fully vaccinated. And so what they do say is we don't completely know yet if you can be asymptomatic, how likely it is that you be an asymptomatic carrier of COVID if you're fully vaccinated, and if you're an asymptomatic transmit COVID to someone else. So their recommendations is that if you are fully vaccinated, certainly you can gather with some other people who are fully vaccinated without masks. You can else unvaccinated who is low risk in a single household. So if you have a friend who is low risk and doesn't have any and hasn't had the vaccine but doesn't have any comorbidities that would make them at risk for having serious COVID disease, you could go visit them and not wear a mask. But they're still recommending that if you're vaccinated and you're mingling with several households who haven't been vaccinated, that you still should wear a mask. And, and I think we still need to wear a mask in public. I think we have to assume that the people we're coming into contact with aren't vaccinated, and so we want to wear a mask to protect them and also just to make them feel more comfortable.
Got it. Thanks. And if there are more questions, feel free to come with them. You could drop them in the comments. So, as I mentioned earlier, obviously eligibility has pretty much opened up for all Americans. But that has been indicated that is just for Americans that are 16 and age 16 and over. So do we envision that, children will be able to get the vaccine at some point?
Yeah, I really hope that, so I have a 15-and-a-half-year-old son. He's begging to, get that vaccine. And I think Pfizer has submitted data to the FDA last week about the efficacy and safety of the vaccine in 12 to 16-year-olds. And so I hope that they will review that in a few weeks' time, and that we'll hear that Pfizer will expand their use authorization to those who are 12 and older. Moderna is doing similar trials. They haven't finished collecting that data yet, so they are a little bit behind. But certainly, I think there's a big push. The vaccine will be widely available for kids 12 and older for the school year but in the fall. I think we are going to see infants 6 months and older lagging behind. Both Pfizer and Moderna are currently doing trials in children 6 months to 12 years old. Those results probably won't be available till the end of the summer or the fall.
Okay. Good. I didn't even know those were happening, so it's actually good to hear that is taking place.
Those are starting. So they're making good progress, and I think there's good reason to be hopeful that 12 and up will be eligible soon.
Got it. All right. So if you haven't got the vaccine and you live in DC, Maryland, Virginia, how do you get that now?
So you go on to the websites of the respective states. You can just Google COVID vaccine in your state, wherever you are, and it will tell you how to register for the vaccine. So vaccinate.dc.gov is the DC site. Virginia and Maryland also have websites where you can register for the vaccine, and that's going to be your easiest, fastest way to access vaccine in your area.
Yeah. Yep. Cool. Are there any more questions or comments or anything? I I know a lot of the viewers are actually teachers and administrators. So the news that you shared about the trials for the the vaccine for children, I'm sure it's good news for those folk
Yeah.
who are dying to return to in-person school with their kids. So good news is that it's in the works, and we'll learn more hopefully by the end of the summer. I know a lot of parents are definitely looking forward to sending their kids back to school.
Yes, back in. So I think it's really exciting that these trials are going on in kids, and I think teenagers, hopefully, some teenagers are already getting vaccinated, and hopefully the rest of the teens will have access shortly. So it's all moving in the right direction. And I think, schools are going to be some of the first places I think we'll see requiring vaccines. Several colleges and universities have already announced that they're requiring vaccines for their students in the fall. So that's also going to help move us along in terms of getting everyone vaccinated. And that's great news.
Absolutely. All right, Dr. Henn. Well, I will let you go. I don't see any more questions for us, but thanks again. I always enjoy having you on. Wealth of information, and I'll see you next time.
Thanks, Dave. Have a good night.
All right, you have a good night too.
Bye-bye.
All right, you all. So I do want to remind you all that Whitman-Walker is still open for free HIV and STI testing. That is by appointment at our Liz location in Northwest DC, as well as our Max Robinson Center location, which is located in Southeast DC. To make that appointment, you have to call 202-797-4439. As we've heard on the live, COVID-19 is still a thing. In fact, cases are rising. That could be for multiple reasons, those variants that we've heard about. But the most important thing is that we still have to have our COVID-19 practices in place. So that means that you must still stay 6 feet away from any other person whenever that is possible. Continue to wear your mask in public. Avoid large crowds. Encourage work from home if that is an option for you. Again, speak with your loved ones over FaceTime and Instagram or wherever you are able to do that, Zoom. I know the holidays are coming up, and we got Mother's Day and Father's Day and Memorial Day and everything coming up. And so, cases tend to rise around that time. So I know that we want to spend that time with our families, but it's probably more important to make sure that our families are safe. So if you can handle those, spend that time with your family virtually. Social distancing is still a way to care for your community. So help each other out and continue to do that. Also, stay up to date on your local, state, community guidelines by visiting, the websites of your respective states and local government, as well as the CDC. They're constantly updating us on, appropriate guidelines. FYI, the new guidelines around, a fully vaccinated person came out from the CDC a couple weeks ago. I definitely encourage you all to check those out. For those of you who are fully vaccinated, some of those guidelines have relaxed a bit. Continue to wash your hands for 20 seconds and stay at home if you don't feel well. Also, continue to follow us at Whitman-Walker on Instagram and Facebook and Twitter at Whitman-Walker and at Real Talk DC _. And you can follow me at serve_Dave_. I'll continue to update you all on everything Whitman-Walker Health, COVID-19. As much information I have, I will provide. So thank you all for tuning in again today, and I'll talk to you all later.